medication administration, you always want to wash your hands first. Today, I will be administering thiamine intramuscularly and at 8 a.m. for my patients for Nicky's encephalopathy. So to begin, I see that I have the medication administration record, the MAR, and I don't have the physician's order. I see that it is already been transcribed, so that's good. So I will just work off the MAR. So I have my patient, nursing Jake, health number, and date of birth, January 1st, 1960. He has no known allergies, but I will confirm that at the bedside. I have thiamine ordered for today. I will be performing the morning dose. 200 milligrams intramuscularly. Okay, so I will be performing my first check. I have thiamine, right medication. I have 200 milligrams, perfect, right dose. Intramuscularly, can be given intramuscularly, right route, and twice a day, right frequency, twice a day. Looks all good. So I will take a quick look at the PDM. So thiamine is a vitamin B1 medication, and it can be given by a student nurse. It is within the safe dosing range, so that is perfect because it's 200 safe dosing. So for the potential hazards, I will take note of them and I will verbalize them at the bedside as well. So now I will compare. I will add the drug label. Okay. Dose is going to be 200. Volume is 2 milliliters. Diluent, there is none. Concentration is 200 milligrams per 2 milliliters. Date and time is March 10th, 2023. And it's given for 8 a.m. So my signature is SR, SN, UM2, and that's my drug label. So to begin, I will take my 3 milliliter syringe and attach it to my blunt fill tip. But before, I will sanitize my vial for 30 seconds in a circular motion, getting the pad and working through the head as well. So I'll let that dry. I'll connect my syringe to my blunt fill needle. I will pull up the dosing, which is 2 milliliters. I will remove the top. I will inject, and then I will put that. So I will pull the correct dose. Pull up a little bit more than I need. Remove. I will recap, and I will try to remove all the bubbles I can. So I will. Alright, it looks all good, no bubbles. Okay, now I can remove the blunt fill and place it in the sharps, and I can connect the 23 gauge needle to my syringe. So when I connect, I want to calibrate to the correct dose, which is 2 milliliters. Over the garbage, I will connect, and now it is the correct dosing. So I will connect the drug label to my syringe, and it's good to go. So I will perform another check. So I have thiamine, right medication. I have 200 milligrams per 2 milliliters, and 200 milligrams per 2 milliliters drawn up, which is perfect. I have it given intramuscularly. I will make a note on my thing that it's given intramuscularly. And I have it given twice a day. I will be giving the morning dose. Perfect. So this medication is a chemically substituted vitamin B1. It is used for carbohydrate metabolism and pyruvates. If my patient is experiencing any chest pain or swelling, I will make sure to verbalize it and let him know at the bedside. Before I give, I will confirm he has no allergies. I will make sure his blood pressure is normal because this medication can cause hypertension. I will assess serum levels, as well as just take a set of normal vitals. So this medication is given for my patients for Nicky's encephalopathy, which is caused by vitamin B1 deficiency. And I'm just gonna wash my hands before I enter my patient's room. Medication will be returned to the Pyxis, and yeah. So I'll bring my medication. Hi Jake, how are you doing? My name is Rheault, and I'm going to be your student nurse today. I'm going to be administering an injection, okay? Performing a general safety check, the room is clean. He's in a lowered stance in his bed, which is proper for safety. I'm just going to lift you up, okay?
We are making sure that we're not contaminating. At this point, we want to wipe down the top of the vial.
Perfect. So I will begin by comparing my MAR to his bracelet. So I have Nursing Jake. Health number is the same, 312654. Perfect. Date of birth, January 1st, 1960. All right. And I would keep that to myself in my head because I now will ask the patient to verbalize it. So what's your name? And he says Jake Nursing, and your birthday. January 1st, 1960. Perfect. It's the correct patient. So today, I'm going to be administering thiamine, and that is for your Wernicke's encephalopathy, okay? He says okay. So what it is, it's just going to be a pinch in your arm. If you have any shortness of breath, swelling, any itching, please pull your call bell and let us know. I will return in about 30 minutes after administering the medication to check up on you. And do you have any questions? He says no. Okay, so to landmark, I'm just going to look at his shoulder. I asked him, when was your last medication and what arm was it in? He says yesterday and in his right deltoid, so I will be performing in the left. So I will find the acromion process, which is just right here. I can feel it. I go about 3 to 2 fingers down, and I will find right in the middle of the deltoid a mark. So I'm just gonna, it'll be a quick pinch and it'll all be over, okay? He said okay. I'm just gonna cover.
We're going to make the blood film go off. And once again, using sterile technique.
And return to.
We are going to put our option needle.
Perform hand hygiene. Put my gloves
So
on.
over here, we can actually travel right into the 0.5 milliliters. Do that. Here's going to be pushing. And over top of the wastebasket.
Okay, so I'm going to perform my final check. It's going to be to the medication and the MAR. So I have thiamine, 200 milligrams per 2 milliliters. Check the dose. 2 milliliters is drawn up. That's perfect. Intramuscular. I will make note of what deltoid I use. Twice a day. I'll be giving it in the morning. For the right reason, for his Wernicke's encephalopathy caused by vitamin B1 deficiency. And yeah, it is all transcribed perfectly. So this is Jake's arm. I will sanitize for 30 seconds in a circular motion. Sorry, doing a circular motion. I'll let it dry for about 30 seconds and make sure I landmark with my medication. So for intramuscular injections, you do a Z-track method. That is by pulling the skin taut, injecting. Once you remove the needle, you let go. That lets it disperse better in the muscle, kind of making that motion, and so it does not leak out of the arm as well. So I have the medication. I will be removing the lid. I will pull to the side, so place down to the side. I will stabilize my hand on the patient. Inject. Hold here. Inject the medication.
And then possible embolism from that.
Slowly, I have it secured with my other hand. And remove. I will attach the safety into the sharps it goes.
You know what, Matt? I'll go with
And I will put a cotton ball over the site just to apply a little bit of pressure, make sure there's no leakage or bleeding. Okay, that is all good.
So they didn't do
I will ask the patient. Alright, so your medication has been administered. I will pull your call bell and reach. Do you have any questions or could I help you? Would you like any water? He says no. So I'll be back in 30 minutes. Remember, shortness of breath, wheezing, if you have itching, if there's swelling and pain at the site, just let us know. And otherwise, I will see you in 30 minutes. And I will be lowering the head of your bed. Okay, good job. So I will perform a safety check. Call bells and reach. Room is clean. Free of debris. And I will now document. So I'll make sure to I put it in the left deltoid. Okay, and I will do SR for my initials, SN2, and that is the morning dose given. So I'll remove my gloves. Ooh. I now notice I should have removed my gloves after administering the medication.